Welcome back. And our second conversation for today is about the Belize Family Life Association Mobile Clinic Rollout. And joining us this morning, we have the Executive Director of BFLA, Joan Burke Skeen. Good morning and welcome.
Good morning and thank you.
So Joan, let's just start off by talking about what BFLA has been up to. You are such a long-standing organization in this country offering very essential services to women and families. So let's talk about some of the activities that have been ongoing and maybe some of the great achievements from last year.
Okay, thank you for having us this morning. And 2016, I must say, was a very successful year for us. There was quite a bit that happened for us. We, in terms of staffing, we were able to afford a marketing officer because we realized that we still need to allow the public to understand what BFLA is all about. We are not only about contraceptives, which is the contraceptives and condoms. We are much, much more than that. And so we brought a marketing officer on board because BFLA is one of the providers for some of the insurance companies. We provide preventative health packages, which vary from just your urinalysis and blood profile to an entire package of preventative health, where we have total head-to-toe screening, along with EKG, we do PSAs, we do pap smears. And so, you know, we have really positioned ourselves to get, you know, to expand what we provide. We also went full swing in the area of cervical cancer, providing another option, which is the VIA, using visual inspection using acetic acid. And of course, added to that, which is basically a screen and treat procedure, we increase the provision of cryotherapy. And so that also was very successful for us.
Did you have many women seeking service?
Of course, and what the positive for that as well is that we got buy-in from the get-go from the Belize Cancer Society, as well as the Social Security under the NHI program and the Ministry of Health. As a matter of fact, there will be quite a bit going on this year when it comes to the engagement of the Ministry of Health, because a number of their nurses will be trained, because some of their health facilities will be providing those services. We want to ensure that women throughout this country have access to these services, but also to a technique that will allow them a one-time visit. You know, you come, you don't have, like for the pap smear, having to come back for a result, and you know, you're there. It's one inspection and everything is done for you. So I'm really happy that the Ministry of Health is coming on board. We increased our attention to gender-based violence and also to increase access to young persons in Belize. When we look at the many challenges of young people in Belize, we recognize that we needed to increase our capacity to respond. And so we hired another communications or youth officer to complement what we had already. I must again extend our gratitude to the U.S. Embassy, because we were afforded the opportunity to submit a proposal, which was successful, to address gender-based violence, particularly among young persons in the districts of Belize, Stan Creek, and Orange Walk. And that so far has been very, very successful, because we were able to engage a number of partners who respond to the issue of gender-based violence, but also being able to integrate it into our comprehensive sexuality education program, or CSC. As we believe in CSC, we have sufficient evidence that CSC works, and we are hoping that at some point in time we will be able to engage the Ministry of Education further in the discussion around comprehensive sexuality education, which is basically a continuation of the ministerial declaration signed on behalf of Belize by the Minister of Education and the Minister of Health.
Yeah.
And
to clarify, sexuality education means?
And I'm glad you asked.
Because we know it's so sensitive.
And the thing is basically, it's not teaching about going out and having sex. We're all sexual beings. So how do we manage our sexuality? Yes, a part of sexuality has to do with our sexual orientation as well. And we cannot ignore the facts of sexual orientation. And so it's how do you manage how you identify with the opposite sex? How do you deal with you being a sexual person? And so when we engage young persons in the discussion around sexuality, it covers all that. And coming towards the end of the 2016, we were very fortunate that we received a mobile unit, right, which was more like an RV, right, and so that definitely complemented what we already had to basically reach our community to a wider, wider coverage.
And you have always done outreach clinics.
Yes.
But this gives you a facility that travels along with you.
Right, because very often we needed to go into communities where we would have access to a community center, or in the absence of a community center, we provided those services directly from people's home. Sometimes not under the
ideal conditions.
Right. Like, for example, we would provide pap smears from the bedrooms of women. And so we were very grateful for that. So 2017 now we'll see just basically an expansion of what we want to do.
We will definitely get into your mobile clinic, because this is a great achievement on your end. But I wanted to touch, because BFLA has been very resilient over the years, and I mentioned earlier on just how long-standing you've been in this community, and it's not without your challenges. I mean, we've had you on the show talking about being on the brink of closing because of funding. We've had you here talking about responding to the controversies that arise over certain segments of society who start to rally against you and the services that you offer in terms of family planning. How do you overcome and still continue to promote your services given the challenges that you have had with financial your financial situation, and how do you continue to push on with the work that you do, given the fact that there's a very active group within the country who still speaks out against the services that you offer?
Well, Marlene, we know what we're all about, and so we remain focused. And I think that is key for us, that we, despite all the negative against us, there is sufficient evidence in the country, in our health statistics, to prove that there is a need for the services that BFLA provides. And I must say that we, as an organization, have survived different administrations, and that we must be thankful for, because despite the many oppositions out there, we continue to partner with the government, because we respond to many gaps. We are able, as an association or as an organization, to provide certain services in a fashion that the government is unable to, because of course the government respond as a government, and I guess that is what is expected, to certain oppositions, while for us that is not the case.
Yeah.
Because of the work that we continue to do, the successes of our work, we continue to get support from international donors. We continue to get support from our local partners.
Yeah.
And so for that, we have been able to survive. But of course, all that could not happen if we do not have a group of committed and dedicated staff. Right? So we do have committed staff. We do have staff who bring extraordinary skills to the table. And of course, when it comes to leadership, we presently have a board of directors that believe in what we're doing, and the board gives that push, right? And the level of commitment that is necessary for any organization to succeed.
Yeah.
And so coupled with all of that, I believe that's why we are still there, and we will be there for.
Well, you proved that you can maintain your presence, and now rolling out into. Are you moving into newer areas with your mobile clinic?
Well, definitely. Right, because we are hoping that eventually we will be able to have a mobile clinic in every district. Right, and I want to, even though they're no longer here in Belize, but give special thanks to my cousin who donated the mobile unit, and he did so in honor of my dear mom. Right, and him and his wife, they bought a new one, and I already have my eyes on that. Right? And I said to him jokingly, okay, when it's time, when you guys get tired of that one. But definitely, because we do recognize some of the challenges for persons accessing certain services. We want to do quite a bit of work on the southern part of Belize City, because because of the gang situation, the violence and all that, we do know that there are some individuals who cannot move out of their safe space to go not even to the public facilities. Yeah. And so we see issues of teen pregnancy or adolescent pregnancies in these areas. We're seeing issues of malnutrition among kids. We're seeing many, what we believe are preventative health challenges. And so we're hoping that with this mobile, we'll be able to actually go into these communities and provide some of the services that they deserve. Health is a right, and we take it from that approach. The same, we want to beef up our services in the southern part of the country, particularly in the Stan Creek district, because when we look at the mix, it is evident that we need to do more. See, at BFLA, we just don't pull things out of the air when we're planning. We use data to do our planning, and that is what guides us.
And I think that's a key area you were touching on in terms of adolescent pregnancy. I don't know what the current statistics are. I know the last time we spoke with Dr. Robert from the Ministry of Health, she spoke of 1 in every 4 live births being to a teenager, which means we do have a situation where children are having children. Now, and that's been one of the areas that people have been most critical about your work, about educating young people on how to have safe sex and prevent pregnancies as well. In your mobile clinics, will you have outreach information taking place as well, or simply health and screening tests?
No, we will be doing outreach. As a matter of fact, for this first mobile, which is going to be this Saturday on Albert Street, right in
the middle of downtown.
Yes, right. And we want for it to be a family affair.
Yeah.
And so we've partnered with the Belize City Council, and we want to thank them for first allowing us to use the space. Brody's, who have partnered with us, because one of the health services that we want to provide is oral health services or dental screening. And so with that we have Smile Solution from Ladyville, Dr. Baron Bonnet, who has willingly agreed to provide the dental health screening free of cost. Because
fantastic.
For that we're targeting kids, because we are not a country that is into preventative services, particularly when it comes to oral health. We have the Belize Cancer Society that will be looking at cervical as well as prostate cancer, because those are the leading cancers when it comes to looking at the sex
male and female,
right? And with that, they will be providing information as to the relationship between cervical cancer and early sexual engagement and multiple sex partners, all that leads to the possibility for cervical cancer. We have the Kidney Association that will be doing kidney function free of cost. We have the Love Foundation, which provided us with the little tokens for us to give to the kids, because we want to make it fun for the kids. And I think that's it. The Belize City Council, Brody's, the Belize Cancer Society.
So all of these will be conducted in addition to the services that you'll be offering.
And then, of course, we will have our information booth. Where we will be doing public education for specific areas of health, and also interactive activities where we can allow learning in a fun way. So I think it's going to be a day of fun while taking care of health.
What kind of services, if someone goes downtown and wants to visit the clinic, what kind of services can someone be able to offer, access?
Okay, as I said, this we are targeting children as well. So the mobile will be providing health screening for children, because we feel that very often there are some conditions where with early intervention we can prevent certain childhood conditions that we're seeing in the country. But for the adults, we will be doing HIV testing, the blood pressure taking, as well as the sugar monitoring. There will be the referral. So if there's a need for referral, then the that individual will be referred. We are hoping that eventually, as we expand the mobile, we will have a strong partnership with the Ministry of Health, so that whatever we are able to identify via the mobile, we will be able to do a referral to the Ministry of Health.
Now, to be very clear, this is just a small number of services that BFLA offers within your clinics. Do you see, who is your main demographic in terms of who accesses care at your clinics?
We have a cross section because at our clinic,
these are the base one, not the mobile one.
Right, the basic services. We do tubal ligation,
tie off,
right? As I said, we do the package of service or services that we provide on the different packages, which include the head-to-toe screening, the EKG, cancer screening. We do fertility management. And the cancer screening include breast, cervical cancer, prostate, and for the prostate we do both. We do the PSA as well as the digital examination. One of the things that we're pushing for the males also is the testicular examination, because we do know that most men, they're not in the habit of doing a body check, including their testicular examination. And so that is something that we are also pushing. Of course, the whole issue of family planning, which includes not only the counseling, but providing the wherewithal for you to plan your family. And under the youth department, we do quite a bit with skills building for young persons. We provide safe spaces for young persons. We provide spaces for those individuals who could be considered, they're controversial, because we do work with the at-risk populations where they also access our STI screening and prevention services, including HIV and AIDS. We have at our headquarters part-time OBGYN. Right? So we do have at times women expectant mothers who would come in and they do access some of the prenatal services.
As you pointed out, there's so many services that people can be able to access.
Exactly. And so for that reason, we have a cross-section of the population.
And it's good that you have men who access the service as well.
Oh yes, and we're seeing an increase in the number of men coming in for services, and this is because whenever we go out and we do any activities, we try our best to engage men, because the approaches used to get women are completely different from those to engagement, and men must feel that their environment is safe and they can come in and they can speak to someone that is
relatable,
right, and not judge them. We are also pushing quite a bit of our education and activities for the prevention of gender-based violence. And one of the things that we work with our young people is the whole issue of cyberbullying and responsible behavior and decisions. I'm so
glad you mentioned that, because I wanted to squeeze that in before we run out of time. Joan, you work a lot with, your organization works a lot with young people, especially when it comes to reproductive health rights. We've seen the issue on the rise of these documented sex acts that seem to be with very young girls. In addition to having these types of videos and photographs available online, there's quite a bit of cyberbullying that takes place. How have you been diversifying your outreach or your education in this sector, in this area, helping people to understand I know you do a lot of decision-making work, but understanding implications of decisions that they make?
Okay, as I mentioned, we do education in the area of cyberbullying. As a matter of fact, even when we go into schools, a part of our comprehensive sexuality education sessions, we do address the issue, and that comes with responsible decision making. And looking at your future and how this impacts your future as well. And I'm not sure if it was last year or the year before, we actually got consultant in to work with our YAM to address the issue of cyberbullying. And it is not easy because when you listen to what young people are saying, the cyberbullying for some of them is something foreign. They engage in these activities sometimes for fun. There is I think adolescents are the most trusting people. So they trust each other, they trust individuals, and sometimes they cannot understand what are some of the consequences for this trust. Now, whilst we may address issues of cyberbullying, whilst we discourage certain things, there is so much more that needs to be done, not only by BFLE, but it requires a partnership from many stakeholders, including the government. Yes. I think this is getting out of hand. We know that there have been instances where there have been attempted suicides, successful suicides, and I don't know how much more needs to happen for us to really tackle this situation. Because when these videos are being released, sometimes we do recognize that there are adults involved, and then what is being done to these adults? It's like we get response like, oh, this one today, next week can be somebody else, and that it's almost like we have now embraced cyberbullying. Well,
it's interesting. The news did a follow-up talking about trying to protect your children from cyberbullying as a response of this issue. The feedback, however, was very negative. And I want to bring in the societal implications in issues like this. You spoke about needing a multi-sectoral approach to addressing some of the critical areas we're seeing with adolescents in this country, and many of them tied right back into sexual and reproductive health rights and education. We have an ostrich-like approach. If we bury our heads and believe that what used to happen before is what's happening, and not necessarily paying attention to what the statistics are saying, we will continue to see these problems progress and become even more detrimental to the youth population. However, I'm not quite sure if the society, the adult population, not just those who are opposing, but those who really don't have any stakes in the conversation, are buying into what is taking place within our society at this time. And I want to ask from your perspective, as somebody who's been involved in this type of work for a very long time, what do you think needs to be done to get the buy-in from the parents and the adults and the wider public so that we can pressure policymakers to address the situation?
Marlene, you are a part of the UNICEF Children's Rights Program. You grew up in that, so that's many, many years ago. And that came as a result of this country signing on to an agreement, the Convention of the Rights of the Child, where the state, at the end of the day, has a responsibility for children. And I feel that we must hold those who are responsible, we must hold them responsible. And when the parents fail, then the state has to take responsibility. And we do not only take the responsibility from the parents, but there are consequences when you fail as a parent. If we do not do that, we will forever have these problems, because we do know that we have parents who are selling their girls. We know that. We do know that we have, even though we do not want to accept it, we have street kids. And these are the kids who are at risk for such situations. When we look at our adolescent pregnancy rate, When we look at the data that is showing us girls under 14 giving birth, and those are only the live births. We don't know the miscarriages and the induced abortions. We do not have that data. Those are sufficient data to say to us we are failing, and we are not holding those who are responsible for the lives of these individuals. We are not holding them responsible. When, as a parent, when we put certain gadgets in the hands of our children, we must do so responsibly. When we say we have all these high-end gadgets, and we do not monitor, because nothing is wrong with the gadgets, you know. It's how they're being used. And when we do not monitor how they're being used, then that's where we run into problems. Sometimes there are certain things that go on right within the home that expose our children and adolescents. Maybe 3 or 4 years ago, we had the former director or the former country rep UNICEF. And yes, she was bashed for it. And maybe her approach may not have been the best approach, but we do know that in certain communities, the living room is basically functioning as a bar room. And when the alcohol sale is low, the daughters then are being used, right, to provide sexual favors to the patrons. When we close our eyes as a society to these kinds of things, then we, like you said, behaving like the ostrich. Based on the data, our First Lady saw it necessary to address the whole issue of commercial sexual exploitation, or CSEC, as we know it, of our children, particularly our girls. We know what is happening in a tourist village, and we know that for many years. There is enough in our faces to tell us that our children and adolescents are at risk. So it is not surprising that we have reached another stage now where the sexual exploitation of our young people are now being used for, it is marketed. And it is done so through one avenue such as the cyberbullying.
Well, we hope that we can be able to see the issue being addressed. I think a lot of people still close their eyes to it. Unfortunately, perhaps because we don't want to come to acceptance as to where we are as a society, and it's easier to close our eyes or disassociate ourselves than to address the problem.
I think, sadly, Marlene, we don't have, because I don't even want to put myself in the position of the victims of cyberbullying. I can't even imagine putting myself in that position. But we do not have counselors, for example. We do not have sufficient counselors for both these individuals and the parents who don't know what to do. Right? And we do not know the psychological long-term effects on these individuals.
All right. Well, I'm glad that we were able to get your perspective on the issue. We know Belize Family Life Association works in a number of areas, one of them being with young people and trying to get them involved in positive activities. So thank you for sharing your perspective, and thank you for being here. Your mobile clinic starts off this Saturday in front of Brody's. Dental checks, health checks, And many informational booths also available there.
Be out there at 9.
9 till 3.
Yes.
All right, thank you. We're going to go ahead and take a break. When we come back, we'll be speaking to representatives of the University of West Indies about how to put together a career plan. That's coming up after the break.